take the flu shot every year, take baby aspirin every day. Those are misconceptions. And if you look at the real studies, again, you're going to see the truth. And remember, those are driven by the drug companies. The flu shots and you know, all this is driven by the drug companies. And since we're at it, let me go real brief back to the flu. I thought this was very interesting. This is from 2009-2010 flu vaccine formula called Flu-Laval, which nobody sees when they get the flu shot. Okay? So I'm going to use very short. Flu-Laval is an influenza virus vaccine indicated for active immunization of adults 18 years of age and older against influenza disease. And then they go on saying, this indication is based on immune response elicited by Flu-Laval. And there have been no controlled trials demonstrating a decrease in influenza disease after vaccination with Flu-Laval. So they're actually saying in the package, which nobody sees, that we're saying this, but it's not proven by studies. So just to put it out there, same thing with, you know, the aspirin and all that.
What about the whooping cough too? 'Cause we had a concern about that.
Yeah, they want us to do all the shots before the baby comes in, or so.
Yeah, before the baby comes. For you adults,
She wants us to get it now. Like, I have to get on the 16th, but we're probably going to just sign and we're not going to do it. Because I think babies get it anyway. You mentioned diphtheria. I think, isn't that something that it's
pertussis, yeah, it's the DPT vaccine. Yeah. So first of all, that's a new thing for the adults to get vaccinated before the baby is born.
Yeah.
That has not been at all. And here you go, here you're pregnant still with a baby, right? And you're getting the flu shot. So the toxins in the flu shot, or in the diphtheria shot or any other shot, will go to you and to the baby. So it will affect the baby, it'll affect your immune system, it'll affect the baby already. And there is no, how many people get diphtheria? It's unheard of. It's unheard of.
But isn't whooping cough something else, or is this?
It's kind of a similar. It's pertussis, whooping cough. Pertussis. Yes, in the same vaccine. So that would give you all three together, I'm pretty sure. You can get the DT, yes.
Yeah, I know to be vaccinated for it when I was a baby, and I'm sure most of us
Yes.
are.
Again, I cannot tell you what to do, but I would highly encourage you to not do it and do your research on it, because it's not backed by studies or common sense.
Well, we're not doing it now.
All right.
Yeah,
And then
about
when the baby is born, so if you have anybody who has babies, you can definitely opt out, and I highly recommend of the B. You know, you can opt out of all the vaccines, but you really need to be under care with that. But the hepatitis B, that's a no-no, okay? And then what you can do is, instead of doing everything, you know, by months 1, by 6 months, you really spread it so the child is healthier, and you do only the minimum, like you do the DT instead of DPT. You don't do the hepatitis B, even the Haemophilus influenza, you know, you don't even have to do that one. So you may consider, when you're ready for the baby to be born, to really have a talk with a naturopathic doctor, whether it's me or somebody else. Yeah, because there's so much that can be done. So yes, all right, one more question.
Yeah. Is the vaccine that they're giving to the expectant mother, is the whole theory there that it's going to start the vaccination is going to start impacting and helping the baby?
I honestly do not know what the theory is behind it. I would think that it's, yeah.
I would think that it's a stronger immune system for the first 6 months whenever they come out.
It would impact the unborn fetus, and it's so
But
fragile. It has
yeah,
fragile cells anyway.
that's the part that is really, yeah, because again, because that's fairly new, and I wonder how research is this really, because again, the baby is protected while it's in utero, very protected. The mom's antibodies are there, like the immune system is fighting like anything for the baby, like it's going overboard, right? So when the baby is born, as I was saying, the introduction to even the mother's milk and to the foods and to the air and the bacteria, it starts developing the immune system. So when you do something when it's still in utero and it's still growing and developing, I would think that it really shifts the way the immune system will respond. And down the line, it may. I wouldn't wonder if down the line we find out that the children are going to be sicker and less resilient because of it. That's just, you know, just if you think about it that way. So, right. So I have to look into that to kind of have a little bit more idea as to what really is under the study that it brought it up. The one study. Yes.
Any logic to waiting until the child is 3 or 5 even to start the immunizations, especially if you're not putting them in a daycare or, you know, where
At that point, you really, like, their immunity is...
In a daycare, everybody else got the immunizations anyway.
Yeah, but the child that doesn't have the immunizations will be almost stronger, and their immune system will be more developed than the one that got the immunization because of the exposure. So it is healthier to do that, but at that point... hold on one.
For the preschool.
Hold on.
You can get a waiver of personal.
Oh, you can get waiver. Yeah.
that you can
Yeah.
sign that they'll
So
have
it's up to the parents, really. It's up to the parents. But at that point, the child is already probably so healthy that they don't need the vaccines.
But they
It-
probably eventually will be pressured.
You know what is interesting? I was just reading is there is no law that requires the schools to, you know, ask for children to be vaccinated. But in all 50, not in all, but in 50 states, the schools require it. But there is no law
yes, there
actually.
is. I don't know about every state, but yes, there is
In
some states.
in some states, then okay, not in all states.
I've only worked as a school nurse in Texas.
Okay. So there are some states. I don't remember which ones they are. But some states don't have the law and it's still required. So
religious opt-out for the girls.
there is always an opt-out. Beliefs, religious, or your doctor can sign that.
Yeah.
I'm in. I'm in. So let's talk about what to do if you get the flu. There is first of all, okay, no, let's even talk. So your notes, look at your notes. You have a lot there to what to do to prevent the flu. So remember, we talked about the mindset. We talked about healthy environment. So what is healthy environment? Here we put everything together once again, talking about the liver, the gut, the digestive tract. When we eat healthy, organic fruits and vegetables, lots of grains, we eat lots of anti-inflammatory foods like nuts and seeds, that is going to keep our body healthy. And that is going to keep our immune system stronger to fight anything. So remember that overall health is, and if you do get sick, it's going to be quick and it's going to reset your immune system. So that's very important, is the internal environment. And then, of course, the rest. Sleep is very important. I don't know if you notice, or know somebody, you know, when you go, there's this stressful period. You keep going and then, you know, at the end of it, you get sick. It's like the body is pushing the adrenaline and it's kind of keeping the immune system going, and then finally the body's like, oh, I got a little break. So it gets, so remember rest and emotional well-being and exercise also. So when you are really sick, do not exercise, but truly actually at the beginning when you're getting a little cold, the beginning of the cold, exercising helps because it moves the blood. Yes, Dee?
You know where I'm going to go. And if you are starting to get sick,
That's right.
you're starting to get a little fever or feel like a cold coming on, take vitamin C and do a colonic. And it will kick it right out.
I didn't even, because so the prevention piece, vitamin C, absolutely, but when you get sick, and we'll talk about what to do when you get sick, activated charcoal is another part that I didn't add there. You can take to bind the toxins from the colon. So Dee is amazing colon therapist. That's a great idea. I didn't think about it.
Babies' enemas, they used to
Yes, that's true. Yes, to move. It hydrates you, first of all, very much, and then you get all the toxins out. Beautiful one. Thank you. I'll add it to my notes. But remember the basics. The big one is vitamin D. You have heard a lot of vitamin D. It's becoming the vitamin to take when you have flu. But the reason for that is because it's an immunomodulator. So it actually not only helps to decrease inflammation in the inflammatory illnesses, but it also upregulates the antibody production in the immune system when we're sick. So prevention for adults, anywhere from 2,000 to 5,000 IUs Children below 5, about 1 to 2,000 IUs, or 35 nanograms per pound. So you can calculate that. You have it all in your notes. So vitamin D is a good one. Then the other one that I really like are these little tiny pellets. It's a homeopathic remedy, and it's called influenzinum. And it's like a homeopathic flu vaccine that helps you stimulate your immune system. You just take one pellet. It's, for anybody, just take one pellet every 3 weeks throughout the flu season. So I love that one. The other one that's great, and especially for children, is elderberry. You can take it in a tincture, in a capsule, or a syrup, which especially children love. So elderberry is a powerful herb that helps to up the immune system. NAC, N-acetylcysteine, is a really good one, especially when the lung symptoms are present. It really helps. It creates thins the mucus, and it helps the lungs a lot and expel the virus and the cough.
Did you say NAC?
NAC, yeah. The reishi mushrooms and all that. There are a couple more potent supplements that you can find that I really like. This one from company, you'll find it smaller, but from a company called Herb Farm, is their Echinacea Golden Seal compound, which has about 8 different herbs. And I like this one for a prevention, 60 drops every day for prevention, or if sick, whether it's cold or flu, you can take it every 2 hours, 60 drops every 2 hours. It's a really good one. It doesn't taste too well, but you can put it in juice or water. Or then they are couple, like these are, naturopathic doctors' offices, but you can find something similar like these. And what they have is lots of, the vitamin C, the B vitamins, the zinc, the bioflavonoids, the echinacea, myrrh, which is another potent herb to fight bacteria, the berberry, another herb. It has garlic, it has grapefruit seed extract, golden seal, the mushroom. So when you find, if the tincture is a hard one, then you can do a combination of all these herbs and vitamins. Again, the acute immune is very similar, has a few more things in there. But couple a day as a prevention, or if you're flying, 2-3 times a day, is wonderful. And if sick, again, 2 every 2 to 3 hours. It really makes a big difference.
How about astragalus? We start taking that because we get a lot of research
Mhm.
online. It's really good for your immune system.
It is.
It's good for reproduction if you're pregnant.
Mhm.
But I'm also a little worried taking it. When we take it though, we take it every day now a little bit.
It's a good immunomodulating herb. It is not recommended when you're acutely sick. When you have acute illness, it is not recommended. So for a short period of time, you can take it for a few months, but not for flu or not for cold. So you would actually stop it if you get acutely sick.
Yeah, we just started about a week ago.
That's okay.
We're going to stay away from the flu shot, but we're going to
Yeah.
do natural.
Or the Echinacea Golden Seal, just those 2 herbs would be great.
We mix them together.
That's perfect. Those,
So that's what I give them.
yes,
Is that what you were talking about, echinacea?
Echinacea Golden Seal, and she was talking about astragalus. It's another herb.
I didn't pronounce it well.
I-
How to?
Yeah, I
Sorry.
don't know what you're talking about.
I'll write that because
Thank you.
to write that to be able to spell it. So astragalus. It's a Chinese herb that helps to modulate the immune system. The other, if here you're in town, so I love this treatment called ozone therapy that you have written in there. It is such a powerful treatment. Again, it's approved all over the world. Canada, it comes from Germany, it's used in Australia, Russia, all over. And there are different treatments. There's one that kind of works like a flu shot. I like it. It's not, I cannot say it works like a flu shot, but you take a little bit of your own blood, gets ozonated, and it basically activates the blood, and then the blood gets injected into your muscle, which what it does, it really stimulates that non-specific immune system, the natural killer cells, the part of the immune system that's on alert. It's almost like your own blood goes in, and the immune system goes and checks it through, and it wakes up the immune system, it activates it. It's a beautiful therapy, whether it's as a prevention or as a treatment if sick. Then there's other treatments like IVs and IV ozone that are so potent. If anybody ever is sick, big time sick, that they cannot take care of it, yourself. I had a patient when the swine flu was it was like a couple years ago. He was so sick. he was sick where, you know, he said, I think I have to go to the emergency room. Like, I can't breathe. Like, I'm so sick. So I said, just come here, because in the emergency room, they were just giving fluids, you know, and the antiviral medicine at that point. But truly, he came, and we did chest x-ray to make sure he doesn't have pneumonia. He couldn't breathe. I was like, he probably has pneumonia. He didn't. I did one ozone treatment, that major with the blood, you know, with more blood. He sweated everything out overnight, and the next day he was 90% better. Like, he couldn't believe it. Next day, overnight, 90% better. When it was so severe, so intense. Again, what these treatments do, or these medicines do, they help the immune system to do the work. Right? They have some antimicrobial properties where they kill the virus, bacteria, but they help the immune system to do what it knows to do.